Good morning, dear students. So, in the previous class, we have seen the definition of health, illness, and illness behavior. So, as a continuation of that, we are going to see about the health illness model. So, in this session, we are going to see illness wellness continuum and health belief model. So, first of all, we'll see about the illness wellness continuum. So, model it is a theoretical way of understanding an idea or concept. Illness wellness continuum was first envisioned by Dr. John Travis in 1972. So here you can see the illness wellness continuum. So you have to draw this diagram and learn this diagram. In this diagram, there are two arrows in opposite direction. One arrow towards the right and one another arrow towards the left. And at the junction, it is known as neutral point. It is written as no discernible illness or wellness. So the one arrow towards the right, that is the indicates the wellness continuum, and it leads to the health and high level wellness. And this can be achieved by, it is written as three circles you can see: awareness, education, and growth. Another arrow towards the left, that is the decline of health or towards the illness. The person experience signs, symptoms, and finally disability, premature death. So these are the two arrows, that is one towards the right, that is wellness continuum, and towards the left, that is the illness continuum. The model illustrates two arrows pointing in opposite directions and joined at a neutral. Movement to the right to the arrows equals an increase in level of health and well-being. It can be achieved in three steps: awareness, education, growth. Movement to the left to the arrows equates a progressively decreasing stage of health achieved in three steps: signs, symptoms, and disability. And this model it compares treatment model with a wellness model. So you can see there is a treatment paradigm and wellness paradigm. So down it is written as treatment paradigm. So treatment paradigm means we are treating a person and the person coming to a neutral point. For example, for a hypertensive patient, we are giving some antihypertensive medication and the person is coming to a normal point, that is normal BP. But that is the wellness paradigm. It crosses the neutral point and moving towards the high level wellness. That is, in wellness approach, we are managing a hypertensive patient with antihypertensive medication, and the person is coming to a normal level. But apart from that, we are moving further. With the help of awareness, education, and growth, we are achieving, or the person is achieving, a high level wellness. That is, the person is doing certain exercises, following strict dietary approaches, and because of all these measures, the person is achieving high level wellness. That is the wellness paradigm. So this is about the illness wellness continuum. Hope you understood. There are two arrows at a neutral point. One arrow is towards the right, that is the high level wellness, towards high level wellness. Another arrow towards the left, that is the illness arrow, that is towards premature death. And it compares wellness paradigm and treatment paradigm. So this is about the illness wellness continuum. So moving further, health belief model. Health belief model, it is a psychological model that attempts to explain and predict health behavior by focusing on the attitudes and beliefs of individual. Here you have to remember two things. We are explaining and predicting health behavior. And for that we are focusing on the attitudes and beliefs of individual. So that is why this model is known as health belief model. About the theorist, the group of social psychologists in the year 1950s and Godfrey Hobsbawm, Stephen Kegels, and Irving Rosenstock. So this model is also known as Rosenstock model. So in this health belief model, from the diagram itself, you can see certain construct. So the five major constructs you can see, that is perceived susceptibility, perceived severity, perceived benefits, perceived barriers, cues to action, and self-efficacy. We'll see one by one. First is perceived susceptibility. A subjective belief that a person may acquire a disease or enter a harmful state as a result of a particular disease. That is, for example, after the visit of a health worker, a smoker is identifying or he is understanding that because of the smoking practice, he may get lung cancer. Okay, so that is the perceived susceptibility. So because of that particular behavior, he is susceptible to get some complication or problems. That is the perceived susceptibility. Second is perceived severity. That is the belief in the extent of harm that can result from the acquired disease or harmful state of a particular behavior. So, the person or the smoker is understanding that if he smoke or he may get the severe health problems or the complications is that like he may get some respiratory problems or like effects of nicotine and lung cancer or death. That is the perceived severity. Next is perceived benefits. Belief in the advantages of the methods suggested for reducing the risk or seriousness of the disease of harmful state from a particular behavior. Like if he quits smoking, okay, what all benefits he can achieve? That is the perceived benefits. Next is perceived barriers. It refers to a person's feelings on the obstacles to performing a recommended health action. That is, the person weighs the effectiveness of the actions against the perceptions that it may be expensive or dangerous or unpleasant or time consuming or inconvenient. That is, the person is understanding the barrier that if he quits smoking, like what all unpleasant stimuli he may get. Okay, that these are the barriers. Next is cues to action. To cause a force that would make a person feel the need to take action, and it may be internal cues or external cues. Internal cues like because of smoking the person get cough and respiratory problems. Okay, like and another other problems of pulmonary diseases. So that is an internal cue. So because of that internal cue or because of frequent coughing and all, okay, person feel like I should quit smoking. And external cues like from magazines or from news or and from other media or advices from health workers, or hearing that he's understanding the benefits of smoking, quitting that behavior. And so these are the cues to action. Next is about the self-efficacy, that confidence in a person's ability to pursue a behavior. So at that smoker, initially he may get some obstacles for stopping this smoking, but after that he is getting some confidence or self-efficacy for quitting this behavior. So in this model, first is perceived susceptibility. The person is understanding that he is at risk of getting lung cancer because of smoking. Perceived severity, the person is perceiving the severity of smoking, and these are health, and he is motivated for an action. And perceived benefits of quitting the smoking, and perceived barriers, so he is ready for overcoming these barriers, and all these factors, all these constructs leads to an action, that is the smoking, quitting smoking. And the cues to action, it may be internal or external, and at last he is achieving self-efficacy. So this is about the health belief model. So hope you understood this health belief model. Thank you for watching. Thank you.